Chronic fatigue syndrome is a complex and crippling disorder in which the person suffers with extreme tiredness. This fatigue can't be explained by an underlying medical condition and doesn't go away with taking rest. It is a serious and long-term illness that affects different organ systems of the body. About 90% of people with chronic fatigue syndrome have not been diagnosed. It often makes it hard to keep a job, to do daily tasks, and take part in family and social life. At least 1 in 4 patients is either bedridden or housebound for long periods during their illness. Anyone can get chronic fatigue syndrome. While it is more common in people who are in their 40s or 50s, it can affect children, adolescents, and adults of all ages. It pulls back U.S. economy by about $17 to $24 billion annually in lost incomes and medical bills. The exact cause of chronic fatigue syndrome is not known. It is not clear why this occurs in some people and not others. Some people may be more predisposed for chronic fatigue syndrome than others. It can be triggered by certain viral infections, impairment of immune system, and hormonal imbalances. Although consecutive link has not been established, suspicious viruses that may trigger this disease include Epstein-Barr virus, human herpes virus 6, and mouse leukemia viruses. As the name implies, round-the-clock fatigue is the cardinal symptom of chronic fatigue syndrome. The patient may face problems with memory and concentration. Majority of the affected people suffer with headaches, muscle pain, sore throat, disturbed sleep, and swollen nodes in the neck or armpits. In case of physical or mental exercise, it is expected to experience extreme exhaustion lasting more than 24 hours. There are no specific laboratory tests that can establish a diagnosis of chronic fatigue syndrome. Because the symptoms of chronic fatigue syndrome can mimic so many other health problems, about 90% of the patients remain undiagnosed. Ideal approach to diagnosis includes a careful medical history and comprehensive clinical examination. To rule out many different types of medical disorders, routine lab tests, imaging tests, and special tests may have to be conducted. It is essential to rule out metabolic problems, hormonal issues, mental health issues, heart and lung impairment, sleep abnormalities, and other medical problems. Chronic fatigue syndrome has no cure. Treatment focuses on symptom relief by combining cognitive training with a supervised exercise program. For many patients, low doses of antidepressants can make it easier to cope with the physical and emotional problems, help improve sleep, and relieve pain. To manage muscle and joint pain, over-the-counter pain relievers or stronger pain medications can be prescribed. Graded exercise therapy increases the exercise load gently and gradually without making the symptoms worse. Eating several small meals throughout the day can help with keeping energy levels up. It can be hard for friends, family, co-workers, and loved ones to understand the nuances of chronic fatigue syndrome, and disease education can help them cope up better. Empathy, validation, and tender care goes a long way in caring for these patients. For more information about the chronic fatigue syndrome, list of expert doctors, hospitals, and ongoing clinical trials, please visit www.expertdocs.com.